Now we will discuss a very interesting topic, blood group. Your blood group is B plus or A plus, someone has AB plus. So what is the importance and how we decide what is our blood group? So what is the reason we say that I am having B plus? What is deciding factor? So actually the membrane of the human red cells contain variety of blood group antigen, which is also called as agglutinogen. So antigen if I say, or if I say agglutinogens, both are the same word. And the most important among them is A antigen and B antigen. But there are many more I will discuss. But the deciding factor which will decide the blood group is mainly A and B. So if I have A, I say my blood group is A, someone has B. If we don't have A and B, we say O. So this is called as ABO system. This is called as ABO system. A and B are the antigens which are inherited as a Mendelian dominant character. And individuals are divided into 4 major blood type on this basis. Type A individual will have A antigen, type B individual will have B antigen, AB blood group have A and B both antigen, and O have neither of these. So blood group can be A, can be B, can be AB, or can be O, depending on the type of agglutinogen or antigen. So as a doctor, you must know what are these antigen. Actually, the A and B antigens are the complex oligosaccharides that differ in their terminal group. Only they differ in the terminal group, but only this much is not needed. There is a H gene which code for fucose transferase that add a terminal fucose forming the H antigen that is present in all blood type. Your blood group is A, B, it is immaterial. Main thing is that H antigen is there in all blood type. Please remember, this is important point. Normally, this point is skipped in a lot of books. It is given in genome. So, A also expresses terminal N-acetyl galactosamine on this H antigen. So, H is there on A also. But this A blood group will have more what? This A agglutin will express terminal N-acetyl galactosamine on the H antigen. And type B will express a transferase that plays a terminal galactose. An individual who have both of these is AB blood group, and the individual who have no of this antigen is called as O. But do you think H will be there or not? This is your MCQ, your Viva question. Yes, doctor. H antigen persists even in O blood group. Try to understand this point. This is very important point. Normally we see A blood group, B blood group, O, but we forget about the H. Now this diagram is very important. You can see fucose, N-acetyl glucosamine, galactosamine, and glucose. It is the H antigen. And on the H antigen, if something you can see here, this is your ceramide or galactose. It all depends on this. Ceramide is on the every H antigen. If you see ceramide is on the every H antigen, you can beautifully appreciate what is A antigen and what is B antigen. It depends on that. It is having N-acetyl galactosamine or it is having galactose transferase. Am I clear? This diagram is very important. Sometimes they can just give you this H antigen diagram. You have to represent what is in the A antigen and what is in the B antigen. Am I clear? So H antigen is in every individual. Now, antibodies against this red cell agglutinogens are called as agglutinin. So few terms you must remember. Agglutinogens is equal to antigen. Agglutinin, which agglutinate, which can agglutinate, is actually antibodies. So antibodies against A will be called as agglutinin A. Antibodies against B antigen will be called as agglutinin B. Now you know, doctor, that if I am having A blood group, I have antibody for B. So if there is no antigen, from where you are getting this antibody? Antibody cannot be formed without antigen exposure. Are you getting my point? If I am having A antigen, okay, antibody is against B. So how antibody is formed even when you are not having antigen B? This is my questions. Actually, this is very important question for Viva. In hematology lab, in your grand Viva, in your examination, short question, if they are asking you antigen and antibody, you have to mention this point that antigens similar to A and B are common in the intestinal bacteria and possibly in some food to which newborn individuals are exposed. Suppose that I am having A my blood group is A. So if I'm also having some intestine which is having antigen A, antibody will not be formed, because for them A will be self. But that intestinal bacteria is having B antigen, of course, then antibody will be formed, because for that our body is foreign. So antibody will be prepared for B, not for A. Are you getting my point? So my question was that if my blood group is B, so why I will have antibody against A if there is no antigen exposed from the foreign? Because I mean to explain here is that antigens which are very similar to A and B are in the intestinal bacteria and sometimes in the food which we give to the newborn. A newborn get exposed and antibodies are formed. Are you getting this concept? This is very, very important concept. In one of the examinations I have seen, this question was asked to every UG student, and only one student has given the correct answer. These points are very relevant. Therefore, infants rapidly develop antibody against the antigen which is not present in the cell. If it is A blood group, antibody will be B. If there is B blood group, antibody will be for A. So now you can understand, type A individual developed anti-B antibody, type B individual developed anti-A antibody, type O individual develop both, because intestinal bacteria will have A and B both, and both will be foreign for you. So antibodies A and B both will be developed. Am I clear? But if your blood group is AB, then A and B both antigen are self to you, so antibodies will not be there. They don't have antibody, they are universal acceptor, because they don't have an antibody as per ABO is concerned, not RH. I am talking about only ABO till now. RH I will discuss later on. So when the plasma of type A individual is mixed with type B red cell, when the plasma of type A individual is mixed with type B red cell, the anti-B antibody cause type B cell red cell to clump. This is called as agglutination. When the plasma of type A is taken, what plasma of type A will have? Antibody for B. So you are taking plasma of type A and mixing with type B red cell. So this red cell antigen will be agglutinated with the antibody against B. Yes or no? This is called as agglutination. So agglutinate is antibody, agglutinogen is antigen, and this process is called as agglutination. Am I clear with this concept? Okay. The other agglutination reaction produced by mismatched plasma and red cells. This is the type, this is a variety how it is produced. ABO blood typing is performed. How you know that which blood group is there? By mixing an individual red blood cell with anti-sera containing various agglutinin on the slide and seeing whether agglutination is happening or not. Suppose I have taken my blood and put lot of sera from anti-B, anti-A and all. If my blood group, it is agglutination is happening with the type B, anti-B, antibody B, it means my blood group is A. My blood group is A, and it might be having antibody for B. So remember that if I am having blood group A, antigen will be A, antibody will be B. So ABO blood typing can be performed by taking RBC with anti-sera of other antibody. This anti-sera is having what? This anti-sera is having antibody to check, because if antigen is A, it will react with antibody A. If antigen is B, it will react with antibody B. So you can judge which antigen is present by agglutination, by seeing the clumping, because antigen A will clump with anti-A, antigen B will clump with anti-B. If anti-sera A is clumped, blood group is A. If it is clumping with anti-sera B, blood group is B. Am I clear? By very simple mechanism, in the lab this practical is done. You can understand which blood group is that. That is why these antigens are there. So there might be incompatibility also. I have told you that AB blood group is universal recipient. No antibody is there. As far as ABO is concerned, I am not talking yet about RH, because they have no circulating agglutinin and can be given blood of any without developing any transfusion reaction due to ABO incompatibility. There will be no ABO incompatibility in AB blood group. But type O individuals, they are universal donor. Why? Suppose that if I am type O individual, what does this mean? If I am giving someone to type O, I am having neither antigen A nor the antigen B. So type O, as far as ABO blood group is concerned, they are universal donor because they lack neither A antigen nor B antigen. So type O blood can be given to anyone without producing any type of ABO incompatibility. Am I clear, doctors? These points. Now, a procedure that has recently been popular is to withdraw the patient's own blood in advance for the elective surgery. Sometime before surgery, we just withdraw our own blood and infuse this blood bank. It is called as autologous transfusion. If a transfusion is needed during surgery, I will donate my own blood to myself, autologous transfusion. Okay. And with the iron treatment, if you are giving the iron treatment, 1 liter to 1.5 liter can be withdrawn over 3-week period. These are the clinical relevant point. See, I am telling again and again. Now we are not doing BSc in physiology. We are going to become doctors. So whenever you are studying any topic, try to remember, understand the clinical relevant point. What is use of this understanding ABO in the clinical setting? What are those facts? One fact is that autologous transfusion can be done before or prior to the surgery. Then they will ask you, okay doctor, you know this, but can you tell me how much can I take? 2 liter, 3 liter, 4 liter? Then you can say within a span of 3 weeks, you can take 1 liter to 1.5 liter or 1000 ml to 1500 ml. And this popularity of this banking of our own blood, it is because of fear of transmission of infectious disease like HIV, hepatitis. It's very common nowadays. This is having advantage of eliminating this type of risk of having any type of transfusion reaction or any disease. So you can see here in this diagram, type A and anti-B. If there is type A means what? What do you understand by this diagram? Anti-B serum is there, anti-A serum is there, and it is agglutinating in the first slide. Which blood group? Which blood group it is? Of course, A blood group. A blood group means it is having A antigen and B antibody. Yes or no? But you are taking only RBC, only A antigen you have taken. So it will clump with what? Anti-A or anti-B. If blood group is A, it will agglutinate with anti-A sera because it is having antibody for A. If blood group is B, it is clotting with anti-B sera, and if blood group is AB, you can see in the both slide agglutination is happening. Okay, so by this you can judge what is the blood group. Now, inheritance of AB, I have told you already that A and B antigens are inherited as Mendelian trait. Suppose that an individual with type B blood may have inherited from B antigen from one parent, or B from other, or O from other. If I am having B blood group, okay, of course one of my parent can be, other can be O also. So B either can, my allele will be BO or BB. Yes or no? So thus an individual with phenotype B may have genotype BB, I am homozygous, or BO as heterozygous. Yes or no? So this is how blood group are treated. And when the blood type of parents are known, the possible genotype of the children can be stated. When both parents are type B, it means B, they can be BO also and they can be BB also. So when both parents are type B, they could have children with genotype either BB when B antigen is from both parent, or BO if B antigen from one parent and O from the other heterozygous parent, or even OO. Suppose both parents are BO and BO, it can be OO. So blood group can also be O antigen from both the parent, both being heterozygous. If both are heterozygous, if both are homozygous, BB, then only condition is that all children can be B. If BO, BB, then it can be either B and O, or B also. No, because O can only be when both are heterozygous, BO and BO, only then you can have OO, that is O. So this is how you can understand that what are the blood group of the children if you know the blood group of the parents. So you can know the blood group of the children if you know blood group of the both the parents. Now regarding transfusion reaction, dangerous hemolytic transfusion reaction can occur. when blood is transfused into an individual with incompatible blood type. That is, individual who has agglutinin against red cells in the transfusion. Agglutinin is what? Antibody. I keep on reminding you, agglutinin is antibody. See, the blood group, the antigen of those who is giving the blood will be important, and antibody of the recipient will be important. Because when you are giving, plasma is not that much. Plasma in the transfusion is usually so diluted in the recipient that it rarely causes agglutination even when the titer of agglutin against the recipient cell is very high. So we don't consider antibodies of the donor. So the plasma in the transfusion is usually so diluted in the recipient that it rarely causes agglutination even when the titer of agglutinin against the recipient cell is high. The recipient plasma has lot of agglutinin against donor red cell, then you can see agglutination can happen, hemolysis can happen. So what we should consider? Antigen of the donor and antibody of the recipient. Okay, because plasma of the transfusion is in the recipient will be diluted, of course. So like this we can understand. And now if there is if there is a transfusion reaction, free hemoglobin can be liberated into the plasma. Free hemoglobin can be liberated, and the severity of this resulting transfusion reaction may vary from sometimes asymptomatic minor rise in the plasma bilirubin to severe jaundice, and sometimes even renal tubular damage, sometimes even leading to anuria and death. So this transfusion reaction can be minor. Sometimes they have only suppose increase in plasma bilirubin, but sometimes there can be severe jaundice with severe renal tubular damage. Now, beside ABO, are there other agglutinogen also? Agglutinogen means antigen. Yes. So, in addition to the ABO system of antigen in the human red cells, there are systems like Rh, MNS, Lutheran, Kel, KID, and there are many others, but they are not that important. Okay. There are over 500 billion possible known blood group phenotype. Can you see the variety? There are over 500 billion possible known blood type. Their undiscovered antigen undoubtedly exist. It has been calculated that number of phenotypes is usually in the trillions, but they are not significant because they don't cause any clinical reaction. We are doctor, we are not scholar, so we are concerned about those things which are important for life. Now, the number of blood group in animal is as large as in the human. Now, there is an interesting question: why the degree of polymorphism developed and has persisted throughout the evolution? Certain diseases are more common in individual with one blood type, and some certain diseases are less in some other blood type. Okay, so the significance of this recognition code is therefore unknown, not very much known. This is not in the known area, but it has been seen some diseases are common in some blood group, some in some other blood group. So this area is very much undiscovered area. A lot of work has to be done. Now, beside ABO, one more blood group is important clinically, that is Rh group. Antigen of the ABO system, those of the Rh system are of greatest importance. ABO system and Rh, these two are more important. Actually, Rh means rhesus, monkey. The first time we have studied this antigen was in the monkey, rhesus monkey. It was studied there in the blood of that animal, and it composed of C antigen, D antigen, E antigen, although it is actually many more, even more than C, D and E. Okay, but among all these, we are only considering D antigen, because out of all, D is by far the most antigenic component, and if we have D antigen, we say Rh positive. So whenever if I say Rh positive, it means simply I am D positive, and if I say Rh negative, it means we are not having D antigen, and D protein is not glycosylated, and function is not known also. So Rh negative antigen will have no antigen, but also not antibody until you are exposed to some type of blood. Suppose that if I am AB negative, it means Rh is negative, it means D is negative. I will not have antibodies also, because these antigens are not present in the intestinal bacteria. These antigens are not present in the food item, just like in the ABO. Okay. So Rh typing serum, usually we say anti-D serum. If in the Rh typing we are taking only anti-D serum. If it react to anti-D, it means I am Rh positive. If it does not, it means I am Rh negative. Okay, so 85% of white population is D positive and 15% are D negative, and over 99% of Asian, we are Asian, 99% are positive. Okay, if you see anyone, almost most of you are positive. Now, antibodies of the ABO system, anti-D antibody, do not develop without exposure of the D negative. I told you, like in the ABO, if you have antigen A, you have antibody B. If you are blood group B, you have anti-A. But in the case of Rh, until you are exposed, you will not have any type of antibody for Rh. It can only happen by transfusion or by entrance of the fetal blood into the maternal circulation. There is no other way. So, D negative individual who had received a blood from D positive blood even year previously can have appreciable amount of anti-D titer, and thus they can cause transfusion reaction if you transfuse D positive blood. So, if any time you have exposed to D positive, you will develop always antibody against you, even year before. Now, this is very, very important point. That is why we keep on looking for ABO and Rh blood group before doing any transfusion. Now, coming to hemolytic disease of the newborn. This is the other complication of Rh incompatibility arise when Rh negative mother is having Rh positive fetus. If the fetus is Rh positive and mother is Rh negative, because some amount of fetus blood will leak into the maternal circulation at the time of the delivery, and some mother develop significant anti-Rh agglutinin, or you can say anti-Rh antibody during postpartum. So, at that time no problem will be there, but after the delivery it will be dangerous for the second baby. Are you getting my point? So, for the second baby we must be concerned. Are you getting my point? So, for the second baby, so during the next pregnancy, the mother agglutinin will cross the placenta to the fetus, and that can be very, very dangerous. Okay, so this can cause Rh incompatibility of the fetus. Okay, so in any case, when anti-Rh agglutinin cross the placenta to a Rh positive fetus, this can cause hemolysis, and various form of hemolytic disease of newborn will be there. They are called as erythroblastosis fetalis. This is called as erythroblastosis fetalis. Sometimes this hemolysis is so severe that infant may die in the utero or can develop anemia, severe jaundice, sometimes even edema. It is called as hydrops fetalis. Now, what is kernicterus? Kernicterus is a neurological complication in which unconjugated bilirubin, if it is increased, it will deposited in the basal ganglion, especially if birth is complicated by the period of hypoxia. Because bilirubin rarely penetrates the brain in the adult, but it does in the infant with the erythroblastosis. Okay, possibly in part because of blood-brain barrier is more permeable during infancy, but not in the adult. And the main reason that the concentration of unconjugated bilirubin is very high in this condition are that production is increased, and bilirubin conjugating system is not mature yet, and production is increased because of hemolysis and all. So, they can also have kernicterus. And because sensitization of Rh negative mother by carrying Rh positive fetus generally occur at birth, the first child is usually normal. This all problem is mainly because of second child. And the hemolytic disease occur in about 17% of Rh positive fetus born to Rh negative mother who have previously been pregnant one or more time with Rh positive fetus. Okay, so this is possible to prevent sensitization. So, do you think there is no chance of having second baby? No, there is possibility to prevent this sensitization for occurring the first time by administrating what? A single dose of anti-D serum, that is anti-Rh antibody in the form of Rh immunoglobulin during the postpartum period. After the first pregnancy, there can be mixing of the blood, and mother blood will start forming antibody. So, before that, give the single dose of anti-Rh antibody so that this sensitization can be prevented. Okay, such passive immunization does not form the mother and has been demonstrated to prevent active antibody formation by the mother. It is not that it will form more antibody, it can prevent it. In obstetric clinics, the institution of such treatment on a routine basis is to unsensitize Rh negative mother who has delivered Rh positive baby, and this will reduce the overall incidence to decrease by up to 90%. If you are giving anti-D, especially within few hours of postpartum period of the first delivery, you can prevent hemolytic disease in the second child till 90%. Okay. In addition, fetal Rh typing with the material obtained by amniocentesis or even chorionic villus sampling is now possible, and treatment with a small dose of Rh immune serum will prevent sensitization. So, fetal Rh typing is possible with material obtained by amniocentesis or chorionic villus sampling. So, treatment with a small dose of Rh immune can prevent it beforehand. So, nowadays technology is so high. So, this is about what is blood grouping and how can you check what is your blood group and what are the main blood group and what are the clinical conditions which you should know. This topic is very important. Please revise this, please write down and do as much as MCQ. Thank you.